Okay, can you hear me now? Can you check? Can you hear me now? Hmm? No, check again. Hello. Okay, you can hear me now. All right. All right. Sorry, there was something wrong. We've corrected that. Okay, so we are saying that a lot of persons. Sorry, I don't know. Okay, today we are going to be discussing something that is actually very important, and that thing that is actually very important is foamy urine. You bet me that if you're having foamy urine, you would have seen a lot of adverts, both online and offline, that have actually promised that they have solution to foamy urine. And some of us would have actually tried out these what they call it, these remedies, and yet the foamy urine still remains. So today we are going to be looking deep into what foamy urine is and the exact way to the exact pattern you can actually use in solving this what they call it in solving this foamy urine problem. So we are going to be dissecting foamy urine so that we also see what foamy urine is, then know how to go about it. So that by the time next time you see foamy urine and you notice foamy urine, or you see all those online vendors trying to sell things that are not really what you actually need, you'll be able to handle it squarely. I used to tell people that by the time you start taking drugs for what actually is not there, like you're taking drugs for something, not like you're using it for prevention, you are treating something that you assume should be there that is not there, you may actually be putting yourself into trouble. Okay, so when you have foamy urine, we are going to look at what you should actually do to be able to do what tackle the situation. But before we start, I want us to take two questions from this book, this kidney stone handbook. Okay, we have 100 essential questions and answers on only on kidney stones. So because the questions I want us to look at, because it's going to affect it has to do with something we are discussing. So let's take two questions from there. So for those of us in this that have been in the group before now, some of us we have the kidney stone handbook, so you can bring it out. Let's dissect these two questions. Then, if you are joining us for the first time and you don't have this book yet, I would advise you to get a copy of the book. So the question number 91 says, "I have been passing pus in my urine after kidney stone surgery. Is it normal?" This is a question that someone who had kidney stone surgery asked me. So the reason why I'm asking this is that when there is presence of pus in the urine, it can actually cause the urine to foam. Okay, because that pus is actually an impurity. So the presence of an impurity in the urine can actually cause one to have what? Foamy urine. So now, passing pus in your urine after kidney stone surgery is typically not normal and may actually indicate a complication. So if you're having this condition and you're noticing this, it means that there is something that is actually wrong and you need to do something immediately to handle that. So what are the possible causes? The reason why you are having pus in your urine could be due to urinary tract infection. It could also be to surgical site infection, the site that was operated. It could also be due to kidney or bladder damage. That is why it is necessary for you to do a quick one and rushed back to the hospital to tell them what you are actually experiencing, especially the place where you did the surgery. That is why it's actually advisable to do surgeries close a place that you can actually access easily. Okay, some people will live in Kafanchan and they will go to Nnewi to do surgery. You need discover that the distance there is too much and the person may not really be able to do what to meet up. Then, having said that, we also have stent related issues. If a stent was placed during the surgery, it may actually cause irritation and all the rest of them. So what you do is to contact your doctor. Your doctor may actually ask you to do urinalysis, to go for image testing and all the rest of them. So how do you prevent, for those who are planning to go for kidney stone surgery, how do you prevent this? You need to do follow-up surgery follow up your post-op instructions. You have to also get good personal hygiene. Then stay hydrated, take a lot of water. So having said this, so let's quickly look at the second question I want us to look at. That's question number 84. So if you're using the book, the Kidney Health Handbook, 100 Essential Question and Answer, you can go to question number 84. Question number 84 said, why do I have lower back pain despite normal scan? Okay, this person have gone for a scan series of, because of lower back pain, they've gone for a series of scan, and um, it doesn't show that they have it's not even showing anything, and they are worried. So lower back pain with a normal scan can be a little bit disturbing. So possible explanation could be due to muscle pain. That what you're having may not really be kidney related, it be due to muscle pain. Okay, it could also be due to poor posture. Maybe the chair you're sitting is not proper, your bed, all the rest of them. You need to check. So it could also be due to stress and tension. So if you have if the weight of your body is so much, you may also consider losing weight. Okay, so and it will also be due to referred pain, maybe pain happening in another part of the body. You are now experiencing it. So it could also be um, linked to what do you call it, lumbar and all the rest of them. So for you to be able to handle this, you need to consult your doctor and follow up with what he's saying. So these are just the two questions. We have 100 questions in this book that you can actually enjoy. So I know you enjoyed that two questions we just answered. So having said that, let's go into the business of the day. Okay, let's go into the business of the day. So we're going to be talking about foamy urine. What is foamy urine? Foamy urine is actually the presence of bubble in the urine. Okay, so presence of bubbles in the urine. So it could be as little bubbles that will disappear within seconds, or it could be so much like the bubbles that you see in beer. Okay, so that is what foamy urine is. Okay, so now let me tell you, forming urine could actually be a normal physiological process in the body. So it's not every time you notice foaming urine that it's actually a problem. Okay, so when you notice foaming urine, it could be as a result of you holding your urine for a very long time. So if you hold your urine for a very long time, longer than usual, it may actually, when you're going to be passing urine, it's going to come out with force, and that force that the urine is coming out may actually cause the urine to actually what? Foam, to have excess bubble. Then the place where you are actually urinating. So if you're urinating maybe on a sand, or you're urinating in a place that has other substances that can actually react with your urine, they can actually react with your urine, causing the urine to do what? Foam. Okay, so having said that, it could also be as a result of, for those of us that use WC and have our things we use in washing our toilet. So by the time you go there to urinate after washing your toilet after some time, you may notice that there is bubble there. The bubble may not be due to you having you having any issues. The bubble may be due to the presence of the detergent or whatever you're using to wash your toilet that is causing it to form. Okay, so this is it. So if you're okay, and a lot of other things. So when you notice that your urine is foaming, you need to be very, very careful and very, very observant. I have once nursed a patient that is actually very, very observant with his health, and it actually saved a whole lot of things. Okay, this patient usually urinates in his house. So he noticed that every time he urinates in the WC, that ants will come and circle be on the seater. So when he noticed this, he became worried and he went to check his blood sugar level. So when he now checked his blood sugar level, he discovered that it was 335. Okay, 335. He took some medications and followed some process that we actually discussed. And today, his sugar has been controlled fairly. Okay, so that is by the way. So we're looking at what we're looking at today is not diabetes. We're looking at foamy urine. So we are going to hit it. So now, what are the common causes of foamy urine? One of the common causes of foamy urine is dehydration. So when you as a person you don't take enough water, there is possibility for you to have what? Foamy urine. I know that maybe there is something that happened to you. You left where you're staying before and you traveled to another place. By staying in that place, you notice that your urine is actually always foaming. You may think that it's because of you changed location. It may be because the water consumption that is required in the new place that you went to is not the same as the place where you were before. So now, get me clearly, your water requirement or your fluid requirement is dependent on your location. It's also dependent on your state of health. It's also dependent on the meal you eat and the kind of work you do. Okay, so for someone who like I said, that one of the causes of foamy urine is dehydration. So we now say that dehydration can come in different with different spheres. I don't know if you're getting what I'm saying. So we can come in different guides. So we're talking about maybe you traveling to somewhere and you notice that you're having foamy urine, maybe because the water requirement you are taking in point A is not the same water requirement that you need in point B. So by the time you notice that foamy urine, you may actually start thinking that because you changed the environment and this thing started, maybe because of the toilet you used and not the rest of them. It may not be because of the toilet you use. It may be due to you're not getting adequate amount of water. Okay, someone will ask me, how much water should one take? So like I've said, the amount of water you take per day depends on all these factors that I've mentioned earlier. The kind of job you do, where you stay, what you eat, and the medical conditions that you have. So you need to discuss with your primary care provider to help you come up with something that will really work for you. Okay, for those who have kidney stones and they're in my class, I usually tell them we have a target of number of water that they should take per time in order to be able to flush, dissolve, to be able to crush, dissolve, and flush kidney stones. I know this is not a kidney stone class, so I won't be talking much about kidney stones. So let's keep it at that for dehydration. So now, protein in the urine, one of the other causes of reasons why urine is going to form is because of the presence of protein in that urine. Protein is protein is supposed to be in the blood. Okay, but there's a problem when you begin to find protein in your urine. So protein is not supposed to be in your urine. So by the time you see protein in your urine, it will cause that urine to do what? To start foaming. Okay, it will cause that urine to start having bubbles. So these bubbles can be very difficult to flush in the toilet. Okay, so now that we're looking at protein in the urine. Protein is normal when it's in the body, but when it's in the blood, in the urine, it indicates that there is a problem. And well, the problem needs immediate attention, because if you have protein in urine and you do not handle it, it could start from being a little amount of protein to very big amount of protein that will actually cause problem. Okay, so if you have protein, if you are losing protein drastically from your body, okay, the liver would actually help you to produce more proteins. Okay, so I wouldn't want to go into that, but there's a physiology that actually where it happens. So once there is hypoalbuminemia, there's presence of low albumin in the body. The liver is triggered to do what? To start producing one to compensate the loss. So by so doing, this person is passing more proteins, and the more the protein is being passed from the urine, it is actually destroying the nephrons of the kidney. And the nephron of the kidney is the part of the kidney that is chiefly involved in filtration of urine and every other thing. So when this protein destroys this sieve, or the body sieve, or the nephron, as the case may be, the next thing that actually happens is that blood begins to pass from the nephrons, and by so doing, kidney damage sets in. So what am I saying in essence? I'm saying that protein in the urine is actually one of the key causes of foamy urine. So we have some conditions that this is more common in. Conditions like nephrotic syndrome. Okay, nephrotic syndrome may actually present with swollen limbs, swollen face, these eye bags and all the rest of them, or swollen eyelid, and as the case may be. So the truth is that if this is not properly handled, it could rather lead to a lot of serious issues. Nephrotic syndrome often affects younger children, I think between the age of 8 to 16. It could also affect adults as close to 40 years and above. So, but because of the scope of our study, we're going to be limiting it here. Then another causes of protein in the urine is what we call glomerulonephritis. There's a condition that affects the glomerulus of the nephron. Okay, so when this condition arises, it actually destroys the architecture of the nephron, allowing protein to actually escape into the urine. Then we have our favorable UTI, urinary tract infection. So when someone has urinary tract infection, there must be protein in their urine, and that urine is going to form. So the presence of that protein encourages what? The foaming urine. Then we have conditions like lupus, we have high blood pressure, we have diabetes. Okay, these are the things that can actually cause your urine to form. So after you've been very very careful, and the things I mentioned earlier, the presence of the places where you're passing your urine, maybe on the floor, that have something that can react with urea and cause it to form, or the presence of your detergent in your bathroom, sorry, in your toilet, that can actually react and make it look more foamy. So by the time you've cleared all this, you should know that these other things are the common thing. These things I've mentioned are the other common things that can actually cause a foamy urine. Things I've said like dehydration, protein, presence of protein in the urine, urinary tract infection, lupus, high blood pressure, and diabetes. So now you've discovered that a whole lot of things are in this group. Okay, so some people will go ahead and start treatment without knowing what they actually have, like what is actually causing this. So foaming urine could be a pointer to a more serious condition. So by the time you go about drinking every tea you see online, you're not addressing the root cause of this problem. You are causing more harm to yourself. So the best thing you have to do is to present yourself to the hospital, or present yourself to a healthcare provider that is knowledgeable to help you dictate which of this problem are you having. Is the problem you're having, is it due to you're not taking a lot of water? Okay, the problem you're having, is it because there is presence of protein in your urine? If there is presence of protein in your urine, what is the quantity of the protein? Is the quantity of the protein in your urine enough to cause nephrotic syndrome, to be classified as nephrotic syndrome, to be classified as kidney damage? All those, you need to know what it is. Okay, because when you go for tests with simple analysis, they will tell you that you have 2 pluses, 1 plus, or 3 pluses of protein, as the case may be. But that is not just what is needed. You may actually need to go for a more comprehensive test that will give a tangible number of protein in your urine, and you have to check the protein creatinine ratio to be able to know what it is, and then know how to be able to tackle the problem from the roots. So taking online tea is not a solution to what? To foamy urine. Are you hearing me? Is someone getting my point? You will discover that if you're here, you can share your testimony. That most of the time, by the time you keep taking all those teas that you buy online, both online and offline, for foamy urine, you discover that sometimes they may stop and they come back later because you've not addressed them from what? From the roots. So what am I saying in essence? Addressing these conditions from the roots could actually be a lifesaver. So now let's go to solution. I want to. Are we together? Okay, are we together? Sorry, I want to get one or two response. Are we together? Okay. So um okay, getting response. Yes, we are together. Okay, and I know I'm making a lot of sense, right? So okay, sorry. All right. So now we're looking at solutions. I know that a lot of persons came into the group, and what brought them into this group is strictly solution. None of them want to. Um, nobody wants to wait. For some people waited for 3 days or thereabout for the class to start when they saw the ads. So now we are in the class. My duty here is to guide you. Okay, that's why. Sorry, I didn't introduce myself. I introduced myself when the voice wasn't coming. I'm Onovo Victory, and I'm your kidney health coach. Okay, we've been in this business for the past 6 to 7 years, helping those who have kidney issues to become better again. And if you're here, I pray that we'll work together and we'll get a lasting solution to whatever the problem is. So if the issue you're having is due to dehydration, you need to what you need to do is to increase the number of the number of fluid you're taking per time. So by the time you correct the number of fluid you take per time, the foamy urine will disappear. One of my clients told me that whenever they drink enough water, that the foamy urine disappears. When you don't drink enough water, it comes. That what is the solution? I said the solution is simple. Keep drinking what? Enough water. So if that is your problem, if that is your case, so keep drinking what? Enough water. So then we also have changing of lifestyle modifications. Okay, we have lifestyle modification. If you're having foamy urine, it actually costs you to have some lifestyle modifications that can actually help you. So if you're someone that actually smokes, so you're in the class of people that actually smoke, you need to actually quit smoking, because smoking can actually affect your kidneys and cause protein to be there. So then, if you're someone that takes alcohol, alcohol can actually be a little bit or mist of iceberg, or can actually cause a lot of confusion. Okay, why do I say so? By the time you take alcohol, which has some diuretic effect. Diuretic effect is that it increases your chances of urinating. So by the time you take alcohol and you urinate so much, you may not be able to differentiate the foamy urine induced by alcohol and the foamy urine that is natural for you. So you need to identify this, then know how to handle it. So we also advise that you have a good weight, okay? Because having adding weight or having a weight that is not proper for your age and height and stature can actually lead to a lot of health issues. So that is what we are saying, that you need to actually get to the root and correct it so it stops. So if you are weighing 120 kg, it's not the best for you. You need to reduce your weight. So if you're weighing 130, you need to reduce your weight. It's not the best for you. If you're weighing 90, 100, you need to look at yourself and make necessary adjustment. Okay, I remember few months back, that was in August or October. Okay, I checked my weight and I was weighing 89. I was like, how did I get here? I started working on my weight. I started working on my weight. So by the end of December, my weight reduced to 82. So now we are at 80, and I'm working so hard so much to make sure I bring it down to 70. I pray that works. So you need to give yourself a target health-wise to be able to. So everything is not about drugs or both herbal and this thing. Sometimes lifestyle modification could actually make the difference. So we also have if you've noticed that the problem is protein, you may actually need to either reduce or adjust the amount of protein you're taking per time. Then if what you're having, you just need to note what you're having, okay, what the condition is, then you cut down on that thing or you address that thing. So just like if you're having high blood pressure, what you need to do is that you need to work on your blood pressure. And working on your blood pressure is not just about drugs too. You can work on your diet through diet adjustment, lifestyle modification, and other things. It will make you get to a point that you may not even really need to use drugs again. So, and dietary approach in controlling um, high blood pressure is actually one of the best approaches to use. And we have a product that can actually help you to control your blood pressure. Not really like is a drug that you take. It's a supplement that you add to the water you're taking, and over time, you discover that you maintain a healthy level of blood pressure, and this foamy urine thing will also disappear. So then, if you are having infection, we also have some. If the foamy urine you're having is due to maybe UTI, kidney infections, kidney stones, because kidney stones could also do that. We have no stone tablets, no stone capsule that can actually help you handle that. So then, if it is diabetes, lifestyle modification, and taking your drugs and monitoring your sugar level constantly and doing the active. Yeah. So if you have diabetes, you can ask me. Okay, there are steps like I told you about the guy that had 335 sugar level. So we worked around some things and he was okay. So we can actually work on something and I believe you'll be fine. So everything depends on consistency, discipline, and knowledge. So for you to have listened from the beginning to this point, it means that you value knowledge. And I believe that you would have gotten the enough knowledge from this broadcast, and it's not this thing is not bad for you. Okay, so you will have gotten something that's very, very okay for you. So, um, that being said, Obi, I don't know if you have one or two questions you can ask here. Let me see if I can take one or two questions before we go back to the group to do one or two questions, to answer one or two questions. Okay, someone was asking me a question in the group about the best solution for kidney stones. Okay, the best solution for kidney stone is anything that will help you remove it without causing serious side effects for you. So we have different treatments for different sizes of the stone. Okay, so you have to know the size of the stone you're having, the position of the stone. Then it will actually guide you to the treatment pattern you can follow. Okay, some stones will pass when you drink little water and when you increase your urine, so your fluid intake. Some kidney stones will pass when you add some drugs. Your doctor may actually prescribe tamsulosin for you and not the rest of them. So some may not pass until there's a surgical intervention. So all those things depend on what the size of your kidney stone, the position, and the composition of your stone. So for someone is asking, is there a cure for hydronephrosis? There's definitely a cure for hydronephrosis, but you have to know what actually is causing hydronephrosis. Hydronephrosis is fluid in the kidney. So what is actually causing fluid retention in the kidney? Is it obstruction? Obstruction may be due to presence of kidney stone, presence of tumor, presence of cyst, and all the rest of them. By the time you know what the cause is, it can also be due to infection. By the time you know the cause, and I think infection is one of the most common, and kidney stone also, they are the most common. They also have strictures. These are the things. So by the time you notice what the problem is, you can actually start your treatment immediately. So someone is asking, please, which drug can someone take for kidney infection? So the best remedy for kidney infection is to run a test. Okay, you should do what we call urine culture test. By the time you do urine culture test, it reviews the microorganism that's there. It also reviews the medications that you should take. So by the time you get the right medications, you take those medications and you'll be okay. So in order to add a seal to the treatment of infection, I also encourage people to take no stone capsule because it has a lot of what they call it, antibiotic um, have a lot of antibiotic properties that can actually help clear kidney infections. And for protein in the urine, most people who have used no stone capsule actually gave testimonies. We have a lot of them in the group. So I don't know, any other question? Any other question? Any other question? Let me give 1 minute to see if there's any other question. So if there's no other question, I think we've discussed for 30 minutes. I think 30 minutes is enough time for us to interact. I want to say a very big thank you to everyone who made it possible for us to be able to have the conversation this evening, from the person who did the arts that brought a lot of us here, my Facebook manager, okay, the one responding to some of your questions. So also to every member of Kidney Health class, I want to say thank you to everyone. Then for because of scammers that may come, please, I'm advising you to save my number. I'm going to put out the number in the group so that everybody needs to save the number. Then please don't post your lab results in the group. They are confidential. So you can actually send it to me in privately, so we can actually have a conversation around it. So if you want us to have a conversation. So then we can talk about solutions too. Then if you want to talk, if you want to ask a question, and the question actually includes you giving me the history of how we started and how far you've gone, it is not best to do it in the group. You can drop the message privately. And before you also give me voice notes, please, like we are talking, so like also there's no, we don't allow voice notes in the group. So if you're going to be giving me a voice note privately, you let me know that you're giving me private voice notes, so I can actually create time to listen to it. Then for calls, please seek my permission before you call me. Okay, like I said, I'm a father, I'm a husband, and I'm a coach, I'm a lecturer, and the rest of them. Okay, so a lot of things that I'm doing. So you need to inform me, so I'll give you time when I'll be free. So all of us will talk and make this place a very joyful place to be. Someone says Jack cure for protein in urine. All this thing we are saying now is a cure. There is definitely cure for this. That means you're just joining us. We've just talked about the cure, so you can bring it up in the group. So we'll also handle it. Does normal urinalysis and kidney function test means my kidney is okay? So if your urinalysis is okay, there's no protein in your urine during your urinalysis, there's no blood, and your kidney function test is okay, it means your kidney is optimal. But the only problem you may be having is if there is structural problems like kidney stone, kidney cyst that may not really show in this kind of test. That means you need to do abdominal ultrasound scan. So someone is asking where can I get no stone? Okay, I can. We will discuss that in the group, and we'll know how to get no stone across to you. But for now, no stone is actually out of stock, so we are waiting to restock no stones, and within the week it will be available and it will get to you. Oh, okay. With that, we call it an end to this beautiful Sunday evening outing. Um, I want to thank you for joining. Someone is saying, is renal cysts and hydronephrosis the same thing? Renal cyst is different from hydronephrosis. And I think that question was cleared in this book. So, Debbie, you may need to get the Kidney Stone Handbook so to be able to answer your questions. Okay, thanks everyone. I'm Oliver Victory and I'm your kidney health coach, saying thanks so much for joining. I love you all.